project.
Thank you very much, Aino. HEAT Finland is a non-governmental, non-profit making association that was founded in 2018. And I'm sure that many of us here have heard of HEAT Finland somewhere or have seen something about HEAT Finland. And we are very, very happy to introduce the Health is Wealth project that is funded by Money Heli for by STEA. Been dealing with Money Heli for so long that Money Heli is almost part of me. It's funded by STEA for 3 years, and as part of that project, we aim to provide information and raise awareness on health issues among immigrants in Finland, and of course, helping them to make healthier lifestyle choices. So our activities include individual guidance sessions. We have open well-being days. We also do a lot of peer support and physical activity groups, and of course, a webinar like the one we are having here today. So we are very happy to have you be part of one of our implementations. Thank you. So yeah, Aina, over to you.
So before we move on to the presentation, we would like to ask you to do a short survey just to let us know what you know about the subject and how you found us today. So I'm posting the link now here in the chat as well, or you can just use your phone to look at the QR code here. So make sure to take a picture now, or use the link in the chat, and we'll be able to do this while we present our first speaker. And I think everyone is maybe doing the surveys, but Emma, I'll give you the honor of presenting.
Yes.
Ernest.
Okay, thank you very much. This is a big one. Oh my God, where do I begin? So our first speaker for today is somebody that is well known. Actually, I'm super happy and super proud to be, introducing Dr. Ernest, the latest in town, and I can't help it, but I have to say that um, we've come a long way. We've come a long way, and he is a CEO of one of the leading migrant companies, home care companies in this country, and has done tremendous work, to make our society and also immigrant nurses, give them the opportunities that they don't have in different places. And I'm super happy that he's here with us today. So, my dear Ernest, welcome. But let me just say that I'm super proud also that you are a former student from Laria. So you're a Laria alumni. Actually, I taught your group. The first group that I taught at Laria was your group. So I'm super happy about it. So I will give you the floor, my dear Ernest. Please just let us know what you have for us this evening.
Thank you very much, Emma. Thank you. We go a long way. Thank you very much. I really appreciate it. I'm very honored and happy to be invited on this platform. I've been silently following all of HEAT's activities. And I have to say that I was very honored when the invitation came. I was so excited. I was like, yes, now I also have an opportunity to share a little bit. Yes. Anyway, I have to I have to say a few things. What we are going to discuss today is purely for educational and health information purposes. If anyone feels that there's a need to seek medical attention, please, it is very important to immediately seek medical attention. Don't base all your knowing on this and have a hysterical sickness because of this information. this information is good, but it's for educational purpose. So that after everything, if you feel the need to consult your own medical doctor or personnel, I will advise you to do that. So this is very important to say first, because I think what we're going to discuss are very pertinent and straightforward. And if you relate to it in any way, don't hesitate to immediately contact your medical personnel for immediate attention. Thank you very much. I will share the screen now. And
Thank you.
yes. Okay. Fully. What did I share? Can you see the screen?
Yes, we can see your screen.
Okay. All right. But allow for 1 month. Okay, so today we want to discuss about prostate. In fact, it was said that prostate cancer, but I wanted to make it go a little bit around it to discuss other things that might also mimic prostate cancer, so that we'll have a wide view understanding of the whole thing. Now, as you can see in this picture, the prostate cancer is located just beneath, of course, we are talking about male health today. So focus your attention there. So the prostate is located just beneath the bladder, and it encompasses the urethra. The urethra is that duct, or that hole, if I'll put it plainly, that when we urinate, it passes through to come out. So that is just a little bit about it. And also, I must say that for the purpose of this, because I considered it an educational material, I have also gone a little bit detailed, that I think when I finish, I will also leave this document with the heat, and it can be shared to as much, because I've made it self-explanatory. When you read it, it gives you a lot of information that you need for yourself. Yeah. So anyway, I would want us to consider a little bit about the anatomy of the prostate cancer. So the prostate is a walnut-sized gland located between the bladder and the penis. I've already said that already. So the prostate is just in front of the rectum. These points are very important because of what we'll be discussing later. It is located in front of the rectum. The urethra, which I said, the duct or the hole, so runs through the center of the prostate from the bladder to the penis, letting urine flow out of the body. These are all important information that we will talk about it later. Another important thing is that it secretes a fluid that nourishes and protects the sperm. Now, during ejaculation, the prostate squeezes this fluid into the urethra and is expelled with sperm as semen. Very important point. Very important point. Anyway, so with that, if you can see my mouse, with the explanation I gave, this is the bladder, and you can see beneath it is this prostate, and this is what we are talking about. And that is the urethra coming, that is going through the bladder, which is also a very important thing to note in this discussion. And then all the other things are there, but our focus today is on the prostate. Now, the prostate gland is divided into, according to the colors, as you can see, the peripheral, which is the blue, the central, which is the violet, and then the transitional zone, which is the green. This will also become necessary as we talk about it, or as we discuss further. Yeah. Now, let's see the normal physiology of the prostate. As we call it, it is a glandular cell. A glandular cell meaning that it secretes, it has something that it secretes. We've talked about it already, and that is the semen. Okay, it is also a smooth muscle. It has smooth muscle cells. It's also a stroma, it also has stroma cells. And then one important thing is that the prostate gland also contains an enzyme that converts normal testosterone into dihydrotestosterone, which is a more potent version of testosterone. We'll later get to know why this conversion is important and why it is so necessary. Yeah. Okay, now the conditions of the prostate. We will be talking a little bit more about the prostate cancer, which is the benign prostatic hyperplasia, and also the prostate cancer itself. And then we also have the prostatitis. All these are important because the symptoms mimic each other. And it's always good that you know exactly what is happening to you so you can get the exact treatment you need, of course, with your medical team alongside. So these are the conditions that can be presented with the prostate. Now, when we talk of the benign prostatic hyperplasia, now, benign prostatic hyperplasia, or the BPH, is an enlargement of the gland. Now, as the prostate starts to enlarge, it exerts pressure on the walls of the urethra. As we said in the beginning, if you see this picture, this is the bladder, and then the prostate is just beneath it. And in between it is the urethra. Now, so this is the normal prostate, as you can see in this picture, which is not so clear. Let's use this. So this is the normal prostate anatomy. But if you see the other one to the right of it, you realize that now it looks enlarged. It looks enlarged. And being enlarged, it is constricting on the narrow opening. That is the urethra. Okay, so this is the point to note. There are also stages in benign prostatic hyperplasia. There is the onset, or the early stage, where it starts and then it develops to the moderate stage and then it goes to the advanced stage. Now, all this is also classified based on the size of the prostate at that point and also the level of constriction of the urethra, or the urethral wall for which it surrounds. So that is that. So you can see that at the early stage, prostate enlargement causes urethral constriction. But then as it goes to the moderate, urethra is narrowed by benign growth of the prostate. And then as it goes on and on, it is fully obstructed. So at the advanced stage of BPH, the urethra is fully obstructed, which means it does not allow passage of urine at all. Now let's look at the etiology. Now the exact etiology of BPH is still poorly understood. In BPH, there is a decrease in testosterone level with advancing age, but estrogen levels does not decrease equally. So in most cases, what has been identified is that, as we know, the testosterone is the normal male hormone that we know of. And then the estrogen, men do have estrogen, but not as high as a female or as the opposite sex. But in this case, you realize that the testosterone levels are actually decreased, and then the estrogen levels remain the same in BPH. So it is said that it could be, although the exact cause of BPH is not known, it has always been attributed that it could be a cause for which BPH occurs. You understand? And then increase in estrogen level also causes hypertrophy of prostate. Hypertrophy also means enlargement of it. Yeah. And then this dihydrotestosterone is the main mediator of BPH. And as you remember, if you remember, we did say that this dihydrotestosterone is the more potent version of the normal testosterone that we have. So the more dihydrotestosterone that a man has, or that the male being has, the less likely that you can develop BPH, or benign prostatic hyperplasia. Now, what are some of the symptoms? The symptoms are usually it is direct. Symptoms related to urine storage in the bladder are the following. So there is frequent micturition. Micturition is just urination. So you see that someone maybe every 5 minutes or every 10 minutes, every 20 minutes, every hour, he needs to go to the bathroom with a very severe sensation and need to urinate, you see, all because of the constriction. So the bladder, there's that sensation of fullness that they need to empty. And then we have the nocturia. Nocturia is not, during the night, there's an increased need to waking up to going to urinate. Then we also have the urinary urgency. Although you might not necessarily urinate, but there is that sensation that you need to go and urinate, And then there is also the urge incontinence. Urge incontinence. You feel to urinate, all right, but so the urge is there, but it's not nothing really comes. You need to really force yourself to push to come, and all this is just related to the urine storage in the bladder because of the constriction as a result of the increase in the cells of the prostate. So remember we are talking about benign prostatic hyperplasia. Now, other symptoms also include difficulty for you to start urination. I try to put this so that it is more understandable. So difficulty for you to start urination, and then weaken in the flow of the urine. When you really have the need to urinate and you start urinate, it really comes with the same strength until the end. But if there is this condition, usually there's a weakened flow of the urine. And then there's also the strain. You strain to pass urine. You really strain yourself to pass urine. Then frequently the need to urinate. And then, as we said, the nocturia, wake up frequently during the night to urinate. And then sudden urge to urinate. And then this last one, blood in urine, it is not usually the case, hematuria. It's not usually the case. It usually happens at very advanced stages of benign prostatic hyperplasia. Now, some other symptoms that are related to urine voiding from the bladder are the following: reduction in urine flow and force. So intermittent micturition, leak of urine drops after the end of micturition, and then feeling of incomplete bladder voiding. This is very classic in BPH, feeling of incomplete bladder voiding, and then urine retention because there's a constriction. Although there is the need or the urge to always urinate, there's always also retention because of the constriction, the prostate, growing big and narrowing the passageway of the urine. There's also dribbling. Dribbling also has to do with just leaking of, or because the bladder is full, it wants to come, but there is that constriction. Sometimes you find that unknowingly, if you sit for long and maybe you are in a party somewhere and you are able to restrict yourself from going to urinate, perhaps by the time you go, you find that your trouser or something may be wet because of gradual leaking, the dribbling of the urine, trying its best to come out from the bladder. I'm not able to go to the next stage.
Okay.
Has something happened?
Okay.
I will stop the share and share again.
Yes, do that.
Okay. Everything has frozen.
Oh no.
Okay, it went away.
Yeah, maybe when you share
I
again.
stopped the sharing, so if you just give it another go now, and let's keep our fingers crossed that it goes well.
Okay. Yeah. Nothing seems to be working.
Oh, okay. So perhaps Aino could share it then. Is that okay?
Yeah, that's okay. I'll go off and come back.
Yes, I'll you can actually stay, or if you want to just stay, and I'll share
Yes.
the presentation, and just let me know when to when
Yes.
to move. So just a moment as I find the right
You
right
might
slide.
go up and not be able to come back if everything is frozen.
That is good. You can at least hear me. So that
Yes,
has.
we can hear you very well.
Sorry, just a moment.
Yes.
Yeah. Hello, doctor. While we are waiting for the slides. Hello, doctor.
Yes, yes, sir.
So, while we are waiting for the slide show, I have a question. I don't know if you've reached the point of what are the preventive measures against this? Okay. Now the slides are there for you to continue. Thank you.
Okay.
Your
Okay.
questions. Keep your questions. Very important one. Just skip it.
Yeah.
Yeah. Okay. So I think I got to the dribbling side. So you
Yes.
we may go to the next. Yes. So the diagnosis of it. So there's always a need for history. And this is the point. When we talk about history taking is about getting a broad information from the client with regards to all presenting clinical signs and symptoms, and even beyond. But this is where mostly we men tend to be men. So we tend to either restrict some information, or we tend to, hide certain things because we think that is personal. As an advice, when it comes to when you ever go to any health facility and you are being asked some questions, it is very important that you try your best to be as honest as possible, because it is this information gathering that will help the medical personnel relate to other information that they have to be able to assist you. So keeping information to you thinking, oh, this one I will not share it, only might delay your healing process if there is a need for any intervention to be put in place. So history taking is very important. History taking might include the possibility of other families or other family members who might have suffered the same condition. You are not disgracing daddy if you say, yes, daddy suffered this particular condition some time back when I was young and I remember it. It is a very important piece of information that will help in diagnosing your case and also presenting solutions that could avert the condition. So that is with the history taking. There are also physical examinations. Now, one thing about the prostate is that because it is just, as we said, located underneath the bladder and also behind the rectum, that we also do digital rectum. We do digital rectum examination. It can actually be palpated via the anal opening to see what is happening. If it has enlarged, it is easy to also feel and know that it has enlarged. So that is one thing. There's also this urinalysis that is done. Cytoscopy is done, ultrasound can be done, all other tests can be done. But one important test when it comes to the prostate and its issues is the PSA, prostate specific antigen. It's a very important test in the diagnosis of any form of condition of the prostate. All right, we can go to the next stage, the next slide. Yes, so like I was saying, as you can see, via the rectum, it's very easy to palpate or to feel for the prostate. So if it is bigger, it can be seen. If it can be felt, or at least the size of it can be felt. So as you can see in this picture, all the other scans can also be done. And as you can see, the ultrasound probe also going in there. It can also tell if there is something. So this was just a graphical image of it. Okay, please, you can go to the next. Okay, so there is this BP8 symptom score, the symptom score. Now, these are all part of the history taking or getting information from you. I think this is, it asks questions like, how often have you had a sensation of not emptying your bladder? Things like that. How often do you, have you had to urinate again less than 2 hours after? So all these are questions that are asked that at least leads one to, or leads the medical personnel to come into a conclusion that something of this nature is actually happening. One thing that I might need to add is that I'll come there, but something has come up. When we talk about the prevalence of any form of prostatic condition, it actually goes with age. So it says that from the age of, I think most books or most presentations say at the age of 50. But I always say that it is better that when you are starting to get it, when you get to around 40, 45, it's also a good time to start being inquisitive about what is happening to your prostate. So one thing is that the potential of getting BPH or this benign prostatic hyperplasia, it increases with age. As one ages or as a man ages, there's a more likelihood that one can get it as compared to a young man. Anyway, so these are all some symptom scores or certain things that can be asked that one can easily be asked during the history gathering. You can go to the next. Okay, so there was another, this is also very important. It's an international prostate symptom score. So this also deals with just about the same questions that was asked there, but this has a score range there. So if everything after asking every question is 5, 5, 5, 5, 5, so it means your score will be higher. And the higher your score, it means that the more likely that you'll be suffering from this particular condition. So this is just for information purposes. All right, please, the next. You can go to the next. Okay, so with all these, the differential diagnosis that can come is prostatitis, bladder obstruction, bladder cancer, or neurogenic bladder. But you see, so it means that it's all these that we have talked about. It's not specific, the symptoms and all this. It's not specifically leading to a particular condition. There are a lot of things that one present when it comes to these signs and symptoms. It can be prostatitis, it can be bladder obstruction. Bladder obstruction also does the same thing. You feel the need to urinate, but it will not be there. You will feel that nocturia at night, you'll be waking up wanting to urine. There's that urge to urine, but it's not coming. Or there's the slow, force of urination or weaker, stream of urination. All those are there. All right, please, the next slide. So it is always important that you follow exactly what your medical personnel is saying and not just assume that because I'm having difficulty in urinating, I have a BPH. No, it doesn't work like that in here. All right. So some of the treatment with this condition, because the actual cause is usually not known at the onset, apart from all other medications and all other plans that will be given, the only thing is, you wait. You have to go through the process of the treatment and keep waiting until a more definitive something is found out. And then you can have a home plan, which I think someone the one to talk about the experience will give us the real life changes they made. to accommodate that condition. And then there can also be medications that are used in the treatment. I was tempted to put some medications here, but I stopped because, like I said, this is for educational purposes. I don't want somebody to think that, I have difficulty urinating. Maybe it is BPH. And then if you have access to medication, quickly you go and get it and be, no. Please, all medications that you take must be prescribed. The reason why certain medications are called prescribed because it is followed. We do follow up on the medication you are taking, interspersed with medical examinations, medical tests, laboratory tests to ensure that it is actually you are getting the right dose and that the medication's effect is actually also being met. So that's why I didn't put. And then there are also other surgical remedies when it comes to this. So radical surgery. So radical surgery means we can go in and quickly do a correction or remove the prostate from there. There's also radiotherapy, that is external or brachy. So all those things are there. And then we have the hormonal therapy. In advanced cases, depends on androgen ablation by bilateral ocheotomy. All these are some of the treatment regimes that are used in the treatment of BPH. All right, please let's go to the next. So when it comes to the surgical treatment, the indications, recurrent attacks of acute retention. And then, so you see, surgical treatment always alters the normalcy, if I'll put it, of any organ. So before surgery is actually an option of choice for any condition, then there has to be some pertinent indications that warrants a surgical intervention. And so for this, usually, if there is recurrent attacks of acute retention, even that is not enough. There also has to be others, like hematuria, urinating with blood consistently. So at that point, we have said that then it means it has gotten to an advanced stage, And then recurrent urinary tract infection. There should also be bladder stone or diverticular. And then so we don't only, or usually medical personnel will not only stand on one indication to implement a surgical intervention or a surgical treatment. Okay, so please the next. All right, so now let's see prostate cancer itself. So this one is, as you can see, the normal prostate, and then the prostate cancer. This is how it looks like. All right, let's move to the next stage so we dive a little bit more. Okay, so prostate cancer, it also starts in the gland cells, and this is called adenocarcinoma. Adenocarcinoma. Remember that when we talked about BPH, we said that it is the enlargement of so there are some differences in these ones that we must take note of. So this one, the growth is actually starting within the gland cells. It's not just an enlargement, but there is a growth that is happening in the gland cells. That's why we call it adenocarcinoma. So the prostate cancer starts with tiny alterations in the shape and size of the prostate gland cells. So there's tiny alterations in the shape and size. And then prostatic intraepithelial neoplasia means dysplagic changes involving glands and ducts of the prostate that may be a precursor of adenocarcinoma. So today, as an educational, line, if you didn't get anything at all, what we are saying is that the prostate cancer, it starts in the gland cells, and this is what we call adenocarcinoma. Oh, sorry, the next slide. Okay, so most prostate cancers are slow growing, very slow growing. However, there are cases of aggressive prostate cancers. Now, if the tumor is within the gland, the cancer is said to be localized and curable. These points are very important. If the tumor is within the gland, the cancer is said to be localized and curable. However, if the cancer escapes the gland, it is considered incurable. At that point, you can say it has metastasized. It has gone to other cells and glands and tissues around a local area. So early detection before the cancer cells escape the glands become very important. And this is why it is important that we do routine checkups on our prostate. Men, including myself, we have to do it. We have to make sure we get routine checkups on our prostate, because if it is detected early, then as we have said, it is curable. But if it is not, because usually all these presenting symptoms may not even show. All the symptoms that we are talking about, bladder, your bladder feeling is full, needing to urinate as often as possible, all this edge, the painful urination, the blood in urine, you might not experience it, but it might be happening. So it is only with frequent check of the prostate or doing this PSA test that can actually tell what is happening. All right, the next slide. The etiology. So as we said, the age is very important. As one ages, there's a more likelihood for it. Genetics, as in family history. So if there are incidents of other older men who have had it, it is also a likelihood. My dad is always calling me. He called me yesterday also, asking, have you started to check about your prostate? It was very funny. I said, I check it. Anyway, and there are other things. Sometimes certain medications, interactions of certain medications can even be, a causative factor also. And then STDs, and all that, other enzymes that are linked to aggressiveness of growth. It's all also linked to prostate cancer. Let's go to the next slide. Now, for this prostate cancer, there are stages. It goes up to the 4th stage. So stage 1, stage 2, stage 3. I tried to get a better picture, but I couldn't. So this is not so clear. But what is important is that before it gets to stage 2, it should be identified as early as possible. That is the lesson here, because you don't wait for it to get to a later stage where there will be need for aggressive treatment, and possibly it might not be safe because it would have metastasized or spread to other tissues around. So these stages is only a caution for us to know that although there are stages, it is always better to have it identified if there is something of that nature early, so that proper interventions can be put in place to avert it. Yeah, please, the next stage. Now, the general symptoms of prostate cancer. Now, during the early stages, the patient urinates more often. The patient gets up at night more often to urinate. So you can see that all these symptoms or signs and symptoms, they relate. It's almost like the same when we talked about BPH. So he may find it hard to start urinating. He may find it hard to keep urinating once he has started because there will be pain. And then there may be blood in the urine, and then urinating might be painful. Ejaculation might be painful. It is less common though, and it is also even less common achieving or maintaining an erection. It might also be difficult, but these two are less common. All right, please, the next stage, the next slide. Now, symptoms of advanced cancer or prostate cancer. There will be bone pain, often in the spine, because at this stage, it would have spread to other areas. So there will be bone pain in the spine or in the pelvis area, the pelvic area, the groin area, or in the ribs. Now, the proximal parts of the femur can be very painful. So you see that there will be, if I'll put it, lower abdominal pain in general, you will feel it. You have lower abdominal pains. And then leg weakness. Now, if cancer has spread to the spine or compressed the spinal cord, so there will be difficulty in even moving. So you will have some weakness in the limbs, and your motor activity might also be impaired. Of course, there will be urinary incontinence. Incontinence just means that you cannot control the passage of urine. It comes. So the best thing is you have to start perhaps using diapers. Now, if cancer has spread to the spine and compressed the spinal cord, all these are there. Or the fecal incontinence, if cancer has spread to the spine and compressed the spinal cord. So there will also be fecal incontinence. So yeah, I think we know what fecal incontinence is. So you might be passing stool without even you yourself knowing. So those are the advanced symptoms of prostate cancer. Okay, the next slide. Now, some of the complications, we've said it already, is if it metastasizes. Metastasizes means the spread of the cancer cells to the other or to organs, tissues, and cells around. So now it is not only the prostate cancer, but then it has also spread perhaps to the bones, to the spinal cord, to the femur bones, to other lower abdominal organs, to the bladder, to all the other parts that are there. So it has metastasized. At this stage, treatment is more aggressive, and depending on the stage, the treatment, there will not be treatment anymore. Then we can only manage the condition. Yeah. Anyway, so and then there's also incontinence. Incontinence, both fecal incontinence and urine incontinence. And then there will definitely also be erectile dysfunction, because as we said in the beginning, there's an enzyme or that helps in the production of semen, which is also released into the urethra. So if all this is obstructed, of course, there's always erectile dysfunction, and other metabolic factors are also impaired. All right, the next slide. I just gave this to sum everything up, because in this example, everything is there. So a 60-year-old man presents to his general practitioner with complaints of difficulty with urination. Now, he describes a weak stream and a sense of incomplete voiding. He describes nocturia, that is, having the need to urine during the night, 5 episodes per night, and has been taking an alpha blocker for this with minimal improvement. He says he can last about 60 to 90 minutes without urination. He denies any suprapubic tenderness, that is, any pain around the lower abdomen or the above the. Anyway, so he has dysuria and he has hematuria. He further denies any back pain or gastrointestinal complaints. If we were in a typical classroom, I would have divided us into groups for us to discuss and come up with, is it benign prostatic cancer or benign, or is it prostatic cancer? Is it BPH or prostatic cancer? But for the purpose of this, I just want to, this sums up a little bit of everything we have said so far, so that you are with me in this discussion. Let's go to the next slide.
Yeah, it's good that we don't do that since we're running out of time.
Exactly. Okay, so I try to speed up. Now, the diagnosis, we have the PSA test, blood test. That is the prostate-specific antigen. Because of time, let's move on. There are other tests, but this one, I'll talk about it a little bit. The next slide. These are other tests that are also done to help, the Gleason scale, to help in the diagnosis of prostate cancer. Please, the next one. The next one. And then the differential diagnosis, prostatitis or BPH. Yeah, the next one. Because of, I think it's true, time is so that. All right, so the treatment is almost the same as with the BPH. So there's medication for treatment, watchful waiting. When it comes to issues of cancer, there's a lot of waiting that must be done. because there's always the need for a lot of tests that needs to be done to confirm the fact that you actually have cancerous cells before you start with all these chemotherapy and other forms of treatment. So there's also the possibility to do this prostatectomy, depending on the stage that it is. If it is there and it has not spread to we can simply take the prostate out. So there's also radiation placed inside your body. There's also chemotherapy and all other treatments that you can think about. Please, the next, because I think I have other important things I wanted to focus on. There's also medication, as we have said already. The next. The next slide. Yes, so the first line of defense against borderline, this is talking about the medications. So it's the first line of defense against borderline urinary symptoms. Now, two major types are the alpha blockers. That is, they relax the smooth muscles of the prostate to provide a larger urethral opening. And then we have the these reductase inhibitors. That is to shrink the prostate gland. I mean, so some of the medications that are used in general have the Proscar and the Abodat. Those ones, I think it's very popular. Anyway, to the next. Emma, how more minutes do I have?
You passed it already, long time ago.
Okay. So we have medication, possible effects of side effects, or possible effects of the medication can be impotence, dizziness, headaches, fatigue, all that. Please move to the next. Give me 5 minutes to round up. The next slide. Yeah, because of my time, there was need to also talk about prostatitis, but I'll make it very simple. Please move to the next. You can be going as I talk because I don't have time now. You can. So prostatitis is just the inflammation caused by an infection of the prostate. Now, this was important because this also causes enlargement of the prostate, but it doesn't necessarily mean that it is cancerous. So it is treated usually with antibiotics, and with that you are okay. Please, let's move to the next. I think maybe during the question time we can talk more.
Yes.
So the etiology of this, or how this comes, is just because there is the presence of a bacteria. So in many cases, or in chronic prostatitis, doctors can't find any infection in the prostate gland. In this case, the cause is poorly understood. When it comes to this, especially prostate, the causes are very poorly understood. So that is why there's a need for the wait time. For lots of during the wait time, lots of tests are done, lots of examinations are done, just to confirm any information that comes up. Okay, let's move to the next. I think the symptoms are basically the same as what we have described already. Difficulty in urination, need to urinate, pain in urinating. Sometimes there could even be blood coming from it. There could be discomfort in the perineal area. That is the gap between, I mean, the bottom down of your the pelvis. There could be a lot of pain there, or the area between the scrotum and the anus. That small gap there. There could be pain there also because of the retention. Please, let's move to the next. So the diagnosis is the same. The blood tests, ultrasound scan, all these other tests are there. But one definitive thing is also the rectal examination, because then you can feel that the prostate has enlarged. Please, the next slide. So it's the same with the causes. What causes it? The age, the ethnic group, family history, obesity, lack of exercise, and diet. So let's go to the next. Let's go to the next. Sorry, I have to run through. The symptoms are the same. Urinate more frequently, often during the night, need to rush to the toilet because of urgency, straining a long time while urinating. Sometimes you have to push a long time before even the urine starts to come, feeling that your bladder is not emptied fully. So the sensation of a need to urinate all the time is there. All right, the next slide. this is where I'll end. This is where I'll end. The prostate-specific antigen test. Now, this is a more definitive or approved test that is done when it comes to the prostate. Now, there have been sayings that it has to be between 1 and 4 when the test is done. But according to research, what they are saying is that that is not the case, because you can have a higher PSA test of 10 but not present with any symptoms, not actually have anything. Maybe perhaps the person is more muscular, does a lot of exercise, or there is some changes going on. So it doesn't actually mean that if your PSA score is high in the blood, it doesn't mean that you have prostate cancer or you have BPH. It doesn't mean that. So the PSA test measures the level of PSA in the blood. For this test, a blood sample is sent to the laboratory for analysis. So PSA test can be used in conjunction with the digital rectum examination, as I've said. They're going through the anus to palpate to see, to aid the detection of prostate cancer in men 50 years or older. Next slide, please. So the blood level of PSA is often elevated in people with prostate cancer. There is no specific normal or abnormal level of PSA in the blood. This is important. In the past, PSA levels of 4 and lower were considered normal. However, some individuals with PSA levels of 4, levels below 4, have prostate cancer. And many with higher PSA levels between 4 and 10 do not have prostate cancer. So how do you explain this? So that means that this alone is not a definitive conclusion to say that one has any form of prostate issue. In general, however, the higher a man's PSA level, the more likely it is that he has prostate cancer. I think I'll end it here. But one thing to also note is that there is a research when it comes to the prevalence. When we talk of prevalence, when we take the racial, the blacks, the Hispanics, the white, and all that, which people are more susceptible to these prostate conditions. It is said that, if you can, please keep scrolling in the slide. It is said that the Africans or African Americans have a higher susceptibility rate when it comes to prostate and AIDS-associated conditions. So it means that me, if I will use myself, me as a black man, I have a higher risk of getting BPH. I have a higher risk of getting prostate cancer. I have a higher risk of getting prostatitis. So it means that knowing this, we should, please, you can move to the next. I don't know who is controlling, but keep scrolling. Yeah. I think that is here. So American is 64% higher among the Caucasian men, and the mortality rate of prostate cancer is 2.3 times higher. So it is imperative that we need to, be more sensitive about this and take the necessary actions. Go as often as you can to book appointments to check your PSA levels, at least the prostate-specific antigen levels, which will start the process if there is anything at all. I think because of time and other equally important presentations ahead, I'll end it here, and possibly if there are other things on other people's minds during the question time, we can talk more about it. I forgot myself, I'm working with time. I wanted to lecture like I'm in the classroom.
Welcome to my world. Thank you so much. Thank you so much, Dr. Kena-Amoah. Let me call you that, please. I know you're a very humble guy, but permit me to address you like that. Thank you so much for this wonderful, impactful presentation. I mean, it felt like I'm in a classroom actually, but I'm so glad that this is recorded, because I'm sure that it's going to benefit other people who did not have the possibility to be here and to listen to you. Thank you so much. And there are a couple of questions that have been asked, and I think that they're there in the chat window. We can address those at the end of the presentation, if you don't mind. Thank you so much. So please, as you guys have heard, chronic diseases are on the rise. Cancer is the giant of them all. and it needs chopping from all directions. Yeah, so we are in this together. So I am going to please help me welcome the next speaker, somebody that I respect so much, Mr. Saini, and a very humble man as well. Today we have really humble men, Yeah, so thank you. So Saini is originally from India, has lived a couple of years, and is a cognitive neuropsychologist. Yes, and he will be talking to us about mental well-being of immigrant men. Let's not forget, mental well-being is your business, is my business, is our business. Yes. So, my dear Saini, welcome. Let's
Thank you
hear
so
what you
much.
have for us today.
Thank you so much for having me. I hope you can hear me and see me well.
Yes, we can.
Brilliant. I will share my screen in case if there are any technical difficulties. I shared a link that you could also use, but let's see if you can. Is it visible?
Yes, it is.
Awesome. Well, good evening, everyone. Thank you for taking out the time to hear us out today. I am really glad to be sharing my thoughts on a crucial matter, and I hope that you'll be able to take home some thoughts that ought to benefit you and your family. Thank you, Heat and Health is Wealth, for placing your trust in me for providing this very crucial information to some of the most oppressed members of our society. While there is limited time for me to speak, I will try my best to be crisp, yet comprehensive. And I have prepared a simple presentation that you could follow that should help you keep track of what I'm talking about. Of course, once the presentation ends, we will have a question and answer session where you can ask all about your concerns. Hopefully, you'll be able to keep up with me. And if you don't hear something or you don't understand, just raise your hand and I'll try my best to resolve that for you. Before I start, Emma gave a little bit of introduction about me, but I still like to very briefly introduce myself and tell you about my background. My name is Harshwardhan Saini, but for the sake of simplicity, you can refer to me with Saini. Nicknames can be a bit hard and long, so my last name is a bit easier, especially for Finns. They tell me I have a Finnish last name. I was born and raised in India, and I was trained there as well. And I've been in Finland as an immigrant for over 2 years. And while I'm waiting for my psychologist license from Valvira, I do a lot of advocacy and lobbying work for minorities of all kinds. And the things I value most in my life are freedom, justice, and love. As immigrants, we have all embarked on incredible journeys, leaving behind our homes, for some even their families, and everything familiar to pursue new opportunities and build a better future. But amidst the challenges of adapting to a new culture, it is easy to neglect our mental health. So today I want to shed light on the importance of mental well-being for immigrant men, the unique challenges we face, and the strategies we can employ to thrive in our new home. Here's a brief list of things I will cover in today's presentation. I hope you would find it informative and instructive. So how does one even begin this journey of self-betterment? As men, we have been constantly told to be strong, cold, and heartless because it is our duty to protect and perform, and we wouldn't be able to do so without that mindset. But while we try to stand up to these roles, we forget we are human beings. Things affect us just as much as they affect women, elderly, and children. And while our cultures might have taught us things differently, medical research has shed light upon the fact that there are quite a lot of similarities interracially when it comes to mental health and its upkeep. But unfortunately, we hardly talk about this in social spheres, let alone between colored men. So there are hardly any resources that explain the first steps one could take. Let's see what they are and what we need to do to better ourselves. The most fundamental step to get support for your mental health is to know that you need help to begin with. To do that, you need to monitor your feelings and actions with an open mind and as honestly as possible. On a general level, you want to look out for exaggerated reactions and feelings. So whatever you notice as being out of the ordinary can usually be seen as a sign that something is off. Feedback from others can come before or after you yourself notice that something is going on. Maybe people have been saying you look more tired or sad or stressed lately, which makes you register it more consciously. After you evaluate your own emotional state, you can ask for more specific feedback to help you understand your situation. Try not to take the feedback as criticism. Instead, understand that it is concern and help from others. This feedback from loved ones can help to reaffirm your life situation and feelings. Although I want you to be very mindful about who you ask the feedback from, because there might be people who either don't care about you or want to harm you. Ask those loved ones who know you well, have been there for you when you need it, and give you a non-judgmental safe space to be yourself. This is an extremely important fact to understand, that the space where you open up your heart has to be non-judgmental. Then the last thing you can do to summarize and finalize your findings is to take some assessments that you can answer and rate by yourself, which was already covered, that I will cover eventually. While I hope that the results of these things don't point towards any potential illnesses, if they do, you don't need to panic, because it's ultimately a good thing that you identified the problem before it became more serious than it was. Also, just a humble reminder that having a mental illness doesn't mean that you're crazy or retarded in any way or form. Something might be wrong, but nothing is wrong with you. Okay, so we have established a few baselines about our understanding of mental health, but how do we protect it? Let us take a deeper dive into the aspects of mental well-being that we need to take care of. And before we jump to answers directly, I feel we should know a bit more about what mental well-being even means and encompasses as a whole. It is about feeling good emotionally and socially, and having a sense of purpose and belonging. Well-being is a collective concept that combines aspects of your mental, physical, and social life. Most people either view it as a singular concept or very physical in nature, but that can't be further from the truth. It is a complex interplay of all these three variables, and we need to better all three in order to better our well-being as a whole. And therefore, as immigrants in Finland, we encounter various stressors related to cultural adjustments, language barriers, homesickness, professional change, and societal expectations, and don't pay it the attention it deserves. However, it's essential to remember that maintaining psychosocial well-being is not only possible, but it's also essential for your personal and professional success. Let's discuss some common challenges that we may face. Being far away from family, friends, and familiar surroundings can trigger feelings of homesickness and isolation. Us immigrants may struggle with feelings of loneliness, longing for connection, and a sense of disconnection from our own culture. Building a sense of belonging and connection in a new country can take time and effort. It is important to find out how you can engage with the local community, participate in cultural events and activities, and form friendships with both immigrants and native Finns, because a lack of them will create a failure of integration, increasing the feelings of loneliness. Immigrants may face barriers to employment, including discrimination, lack of recognition for foreign qualifications, and limited job opportunities in the field. It's important to advocate for yourself, pursue further education or training if necessary, and network with professionals in your industry to advance your career. Adjusting to new culture, social norms, and way of life can be overwhelming, leading to feelings of culture shock, isolation, and identity crisis. It's essential to give yourself time to adapt and seek support from fellow immigrants and cultural organizations. Depression and anxiety. The pressures of working in a demanding and discriminatory environment, coupled with the challenges of adjusting to a new country, language, and culture, can contribute to feelings of depression and anxiety among immigrants. Symptoms may include persistent sadness, worry, irritability, and difficulty concentrating. Stress and burnout. Long and intensive work hours and the emotional toll of caring for family members abroad can lead to stress and burnout. Over time, this can manifest as physical exhaustion, emotional detachment, and loss of passion for their work. PTSD. Based on the current healthcare situation in Finland, more often than not, immigrants come from war-torn areas or countries that have internal conflicts. In the case of Africa as a continent, there have been constant turmoil in several regions due to various problems, and that could have impacted some people and their lives, which prompted them to leave the country in search for a better life. But coming from such backgrounds can have lasting effects, such as flashbacks, nightmares, and anxiety. For women, there is also a high chance of domestic violence and sexual assault, which can trigger PTSD. So be mindful about your sisters, mothers, wives, and friends if you have any. ADHD and other neurodivergence. Neurodivergent people have a slightly different brain structure, which can cause them cognitive dysfunctions such as emotional regulation issues, memory issues, and executive dysfunction. As an African man and as an immigrant, you are less likely to get diagnosed. Hence, it is important to recognize any and all symptoms and seek support. Now, what challenges do you think are specific to us as men? Think about the roles we are often expected to play. We are supposed to be the strong ones, the providers, the ones who never show any weakness, right? But that can be a heavy load to carry. It can make it hard to open up about our feelings, to ask for help when we are struggling. On top of that, there's this idea that we have to fit into certain boxes: the successful businessman, the perfect husband, the tough guy. And if we don't measure up, we can feel like we are failing. And new tags don't stop coming out either. We now have alpha males, sigma males, and then gamma males. We see these ideal men in movies and magazines and all over social media. It's easy to start comparing ourselves and feel like we are not good enough. But here's the truth. Those are just stereotypes. They're not real. We don't have to live up to anyone's expectation but our own. It's okay to not be okay. It's okay to feel vulnerable. It's okay to ask for help, to show your emotions. In fact, it takes real strength to do these things. It takes courage to break free from those old ideas about what it means to be a man. So let's change those stereotypes. Let's support each other in being authentic and vulnerable. Let's create a space where we can all be our true selves without judgment. All right, there seems to be many problems that we face, but what is then one should do and can do? Let us look at different aspects one by one. Okay, so let's talk about mental well-being. Now, this is different from mental health, which we'll get to it in a bit. Mental well-being is all about how we are doing in our minds and our hearts. It's about feeling good, feeling balanced, and feeling able to handle whatever life throws our way. Think of it like this. Our minds are like gardens. We need to tend to them, nurture them, and give them the right conditions to flourish. What does that look like in practice? Well, it means different things for different people. Maybe it's taking some time for ourselves to relax and recharge. Maybe it's connecting with our loved ones, or perhaps pursuing our hobbies, or maybe simply enjoying the little things in life. It could also mean setting realistic goals, learning to manage stress, and practicing gratitude for all the good in our lives. The key is to be proactive. Just like we take care of our physical health, we need to take care of our mental well-being. And remember, it's a journey, not a destination. There will be ups and downs along the way, but by prioritizing our mental well-being, We can build resilience, find joy, and thrive in all areas of our lives. You need to have hope in something, then be motivated enough to want it, and then the patience to work through the challenges. That is how you'll be able to maintain your mental well-being. While you typically don't really include physical health in the entire psychosocial well-being aspect, I believe personally that your mental health will not get better if you do not have a healthy body. As they say, a healthy mind resides in a healthy body, and I believe in that profoundly. So the aspects of physical health that are most relevant for your mental health are movement, rest, and nutrition. Any and all kinds of activities are beneficial to a person's mental health. Exercise releases endorphins, which are hormones that inhibit pain and stress perception. Creative hobbies strengthen and expand neural networks in the brain, which improves learning, memory, and focus while reducing stress. Creativity also allows an individual to express themselves, which makes them feel more confident and happy. Other than the more obvious physical benefits of sleep, it also helps maintain cognitive skills like attention, learning, and memory. Quality sleep helps support everyday coping skills and recover from stress, while poor sleep can even impact our ability to perceive the world accurately. During sleep, our brains are cleaned out by the glymphatic system, which works kind of like a washing machine. It pumps waves of cerebrospinal fluid through the brain tissue, cleaning them of waste, which helps to prevent long-term issues like Alzheimer's. And although it might seem obvious, I will still remind you guys that a balanced diet is important. Hence, I thought I'd mention a few nutrients that are specifically good for your brain. Nearly all vitamins and minerals strengthen and maintain brain function and recovery in one form or another. Vitamin C, magnesium, zinc. There are so many of them. I don't have enough time to cover all of them and tell, but do take care of what you eat. Explore opportunities to celebrate your traditions and cuisine in Finland to maintain a connection to your culture. For example, in my case, I shop at the Indian grocery store and mostly make Indian food at home. Sometimes I watch Indian movies, listen to Indian music, and I look at Indian news broadcasts to stay up to date. If you can, I recommend attending multicultural events, international festivals, and cultural exchange programs to celebrate diversity and foster cross-cultural understanding. If you have special holidays and celebrations, I strongly suggest continuing to celebrate them here. Remember to be patient with yourself and give yourself time to adjust to the new cultural environment. There might be pressure to assimilate to Finnish culture completely, but you shouldn't give in if it doesn't feel right. For community engagement, I suggest participating in social activities, cultural events, and community gatherings to meet new people and create a sense of belonging. One place to look for these is Facebook. For example, you can look for Africans in Finland or foreigners in Finland, and usually you can find groups that meet and give advice. I personally have utilized this service and I have found quite interesting people and I've made friends even. Another way to participate in your community is to simply start a hobby, such as sports, music, or anything that you'd like. This way you can find people with similar interests and build social connections. A very valuable thing, especially in this financial crisis, is to volunteer your time and skills to local charities, community projects, or cultural events to make a positive impact. I mean, honestly, that's pretty much what I did and how I was able to meet awesome people like Emma. So I just volunteered for an organization, and then they said that, hey, would you, Moni Heli is this organization that is doing this advocacy training for leaders of the organization. And I'm like, yeah, why not? I'd love to go there. And I guess I never looked back. I've only made friends and amazing professionals network from there. So it has done wonders for me, and I'm sure that it would do wonders for you too. Cultivating meaningful relationships can be quite tricky, as here in Finland, the culture is very individualistic and people seem more shy. To get into a Finnish person's heart, the key is to stay consistent and persistent. Be open-minded, curious, and respectful towards Finnish customs, traditions, and values, while also sharing your own cultural background and experience with others. It's also important to try and maintain the important relationships that you already have by staying connected with family and friends back home through regular video calls, emails, or letters. You may be a devout follower or you may be an atheist, but more often than not, if you come from a country where certain religious and cultural practices are prevalent, doing them in a foreign country, especially with the community or friends you've made here, will provide you with a sense of homeliness that you might not experience otherwise. As an example, if I talk about myself, I celebrated Diwali with my Russian and Finnish friends, even though I am not a devout Hindu. I not only exposed my friends to my own culture, it also made me feel that I'm back at home. But what happens if you feel that you have already tried all of these things before and it hasn't helped you? Then we need to look at it from a medical perspective. Let us see how we should approach that. The next step should be to assess what is the severity of the problem that you have identified. Is it a chronic condition? Is it acute? Or are you in a state of emergency? A chronic mental illness means that you have already been dealing with it for at least 3 months or more, and the symptoms cause dysfunctions in your life. The onset of an acute mental health condition is sudden and ideally needs treatment right away. This happens after a specific event, like a loss or using drugs. A mental health emergency is any situation where there is a threat to the life of the one suffering or those around them. Typically, these are psychosis, suicidal ideation, and plans to hurt yourself. In this scenario, you should call the emergency number or go to the hospital as soon as you can. Cases of emergency are often obvious, but to understand whether you're suffering with a chronic illness or an acute illness, you can contact mental health services. I have curated both free and paid services that I will share very soon. And I will also share a digital copy with Heat so that they can share it with you. Now, what kind of mental health support can you get? One of the most common forms of available psychiatric help is medications. The purpose of these medications is to either inhibit or stimulate certain neuronal activities in the brain. This acts as a foundation for stability and improvement. Although it is important to note that the medications only offer management of symptoms and not a cure. It is also important to find the right medication for each individual and do an interaction and impact assessment. Please note that abruptly stopping any medication without talking to your doctor, or for that matter, as our amazing doctor pointed out before, starting a medication without a prescription can have very serious impacts. The next form of help is psychotherapy, also known as talk therapy. Because people often lack a trustworthy and knowledgeable person to communicate with, they benefit immensely from a person who listens, participates in conversations, and gives new perspectives and tools to cope in their lives. It is not a therapist's job to tell you what to think, feel, or do, but to help you understand your situation. For psychotherapy to be effective as a treatment, the patient not only needs to trust and get along with their therapist, but to be completely honest about every vulnerable and personal topic. If neither of the more common treatments mentioned work, then there are more specialized treatments available, such as electroconvulsive therapy or VR therapy, something that I'm actually developing in Finland myself. A person's whole lifestyle affects their well-being. If the patient is receiving medication and psychotherapy and their life situation remains the same, proper healing cannot occur. For example, a domestic violence victim suffering from anxiety can't fully start processing their problems before separating from their abuser. And not to add on to your worries and concerns while you're trying to establish if you have a mental illness, but it is not all roses in Finland when it comes to immigrant mental health. Let's see what are some of the challenges in getting the right kind of mental health support for yourself. It is quite, as you read it, it's basically the same thing. Lack of awareness and information. It is possible for that to happen on both ends. Either you might not have it, or the person that you're dealing with might not have it. They might be old, might have they might not have the aptitude with technology. There might be misinformation about where to go or what to do. And of course, as immigrants, when we come to any new country, we don't really have the complete knowledge of how the healthcare system works to begin with. Then, as per my personal experience, I have observed there's a quite big lack of culturally competent services, especially at the public sector. I have not yet seen even a single time where an ethnic person has been given a culturally sensitive assessment to take care of it. More often than not, in my experience, from what my clients tell me and what I have personally even seen as a client myself of the public healthcare system, is that I've been given a Beck depression inventory and anxiety inventory before even any kind of communication has happened between me and the healthcare professional. So it creates a lot of issues for immigrants who don't understand what their situation is. And that kind of information gap between the practitioner and the immigrant then creates all kinds of false diagnosis. But I won't delve into those issues here because I would be going on a tangent that I do not have the time for. Needless to say, there are language barriers that we suffer, and there's, of course, social isolation and discrimination against us in all forms. And one of the most important things that I wanted to mention, that there's a lot of medical gaslighting here that I have observed. So if you go to a doctor and they say to you that, oh, there's nothing wrong with you, just go and take Burana, I think it is in your best interest to ask your doctor that, what is my diagnosis? How did you get to the conclusion that there's nothing wrong with me? Doctors, like any other professional, at the end of the day, are consultants. They're experts of their field and they know what is going on. And as a client of theirs, you have the right to demand the knowledge that they have used to determine that only taking Burana is sufficient for you. So it is your right. Ask them, how did you get to that conclusion? And if you're not satisfied, then request them that if you do not know, write some tests for me, do some assessments, make me understand why am I feeling this way. And that should definitely move your case forward. And I speak from personal experiences that definitely helps your cause, especially in public healthcare. And these are the resources that I've compiled. I can share the files with Emma and with, was it Aino? Right. So
yes, I know.
You can then access all these services. Of course, Emma can supplement these in case if I have missed out on anything, but this should give you a decent amount of information as to where you need to go, depending on your circumstance. And that's about it. I can take question and answers if I still have any time left. I hope I covered it in time.
Yeah. Let's just, there are a couple of questions there in the chat window. We could address them at the end. Is that okay?
Yeah, perfectly fine. Yes.
Thank you so much. Thank you so much, my dear Saini, for this wonderful presentation. I was almost emotional when you were presenting, because it's about mental well-being. You know what I mean?
Yes.
Something goes wrong with our mental well-being, then it leads to a mental problem or mental health problem. So, and very often people just don't know that. We always often think that mental well-being is something that is out from us. It's us, it's within us.
It's within.
And we have to safeguard it at all costs so it doesn't lead to a mental health problem.
Yeah, absolutely.
Thank you so much. Again, big boys don't cry. So I'm glad that you covered the cultural aspect very well, and I'm glad that there are many men here listening, and probably many of them resonate with that as well. But not only not only bringing out those things, but also some of the things that they can do to be able to mitigate the problem. So thank you very much.
Yeah, it's been a pleasure. Thank you for allowing me to do this.
Yes. Yes.
And
so let us
thank
yes,
thank you so much, sir.
Thank you very much, Saini and Ernest, for your talks. And just for everyone viewing the recording, we'll be stopping the recording now. So thank you for everyone who is listening to us afterwards. And for the people here present, we will continue with questions and answers and another speaker. So thank you very much. The recording is now.